Welcome back for tonight's KX Conversation. We're talking about the Delta variant, its spread, and what needs to be done by us and others to help stop it from spreading. And tonight, for tonight's KX Conversation, we welcome Kirby Kruger. He is the Director of Disease Control for the North Dakota Department of Health. Kirby, thanks for being here.
Thank you for having me today.
So, Kirby, July 5th, there were 118 active cases of the coronavirus here in North Dakota. Just today, we're up to now 706. Now, that's a difference of 588. It's nowhere near November when we had more than 10,000 active cases. So I'm sure there's some people at home wondering, well, should this be a big concern, the 588 difference between the 10,000?
Well, I think that the question is a good question. It's a valid question. But I think from our perspective, what we look at what I look at is at least three different things here. Number one, we have our trends going the wrong way. We have our hospitalizations have increased, which is not what we want. Our positivity, our average positivity for the 7-day period has been increasing. And then you mentioned it yourself that our active cases are increasing. It's very similar to what we were seeing last summer. Last summer we began this upward trend towards late summer to early fall, and it didn't quit until we reached that high peak. So I think the other piece that we're watching is what's happening in other states, especially in southern states. And some of those states have exceeded their peaks that they've actually had last fall. And so, that's important. And I think what's driving this is what's important is that the Delta virus has been shown to be much more infectious, and that looking at the infectiousness, when you look at the very earliest versions of the virus, when the alpha virus emerged early in the year, that was about 40 to 50% more infectious than the earlier version. Well, the Delta variant is estimated to be 40 to 50, maybe even 60% more infectious than the alpha virus even. So this is a much more infectious virus. And so a single person has the potential to spread it to a lot more people if they're infected. And so I think those things really have to be taken into consideration here.
We've been hearing for weeks and weeks now, get vaccinated, but there's obviously been a lot of hesitation. Is the number one reason for people not getting vaccinated because it's still emergency use only? Is that what you're hearing?
Well, I think there's a lot of reasons, and I don't think it's fair to pigeonhole reasons, in terms of those people who so far have chosen not to be vaccinated. I think for some people, it's maybe this disease isn't serious enough and I really don't need to be vaccinated. For some people, it might be that it's just emergency use. And for others, it may be, well, did they really test the vaccine well enough, and are the side effects worse than the disease itself? But from our perspective, I think the data coming out is really, really good, that these vaccines are safe. They're not perfect, but they're safe and they're highly effective, and even highly effective against the Delta variant. Maybe not quite as effective as they were for the initial viruses, but showing good protection against disease and really showing good protection against serious disease causing hospitalizations.
And just two quick final questions, Kirby. So what can be done to get more people vaccinated that you haven't thought of yet? And what can those of us who are vaccinated do?
Well, I think it's a challenge. And, I think people need to be comfortable in the decision they make about vaccination, and they need to be comfortable that their source of information is reliable for them. For a lot of people, it's their healthcare provider. So we really are encouraging people to visit with their healthcare provider about the benefits of the vaccination and learn as much as they can about it, and then making that choice to be vaccinated. Then I think the other part of this is, from our perspective, let's make sure the vaccine's available, for people, and we're getting the vaccine to where they want it. And so I think there's a couple things. There's a lot of other things that are going on here, but I think from my perspective, it's making sure people are comfortable with the information that they're getting and that they can make a choice that benefits themselves and others around them, because we know vaccines are very good at doing a lot of different things. They protect the person who's vaccinated, but they protect the people around that vaccinated person, and they help protect the whole community. When the more people who are vaccinated, the better protected a community is.
Good decisions and staying safe is what it's all about for sure.
Yeah. Yeah.
Kirby, thank you very much.
All right. I appreciate your time today.